event yesterday, and they had like disco balls and Elvis there. I don't know if any of you were there, but they started flipping on and off the lights. And we're like, who is doing that? That's dangerous, you know? But there were like tons of people in small areas, and you know, there was what, maybe over 300 people in there anyway. So, okay, so how many first-time attendees do we have today? Anybody? Okay, all right, great. Hi, welcome. Nice to have you here. So for those that don't know me, I'm Stephanie Parson. I am a full-time real estate broker. And here today are some of my fellow teammates and helpers. So we have Kim in the back, Sharon, and Claire, and Joelle, that a lot of you know and have seen her around. She's having her baby today, so our thoughts and prayers are with her. So our team has over 50 years experience in real estate. We specialize in working with seniors, and we also help providing downsizing assistance for those needing extra help to make a move. I was asked earlier by one of our panelists, Dr. Crosby. She said, hey, why did you start doing this? So my answer, Dr. Crosby, is the Senior Empowerment Truth Series was born because we saw firsthand that seniors needed some additional help in late in life decisions, specifically housing and getting things organized to make a move. And there just seemed to be a good opportunity for education. So I'm an education nerd, so I like learning about all of this. We just kind of saw that it could be beneficial and started doing it, and hopefully you guys, once you keep coming, you find it beneficial as well. So thanks for your attendance. Just a couple housekeeping things. Our presentation runs from 10 to 11, sometimes 11:15, so that we can hear information from our expert panelists today. We ask that you hold your questions until we're done with that, and then we will open it up for questions and answers at that time. If you have something really, really specific, they're going to stick around for a little bit afterwards so that you can talk with them, you know, kind of one-on-one. And after, when we're done, we will also have their information and handouts, so that if you want to grab any of that further information, feel free to do so. All right, and then we have notebooks. Some of you have notebooks, some of you don't. If you'd like one, please ask for one. If you don't have one already, if you'd like to become a regular attendee. So we do have a few extra on hand today. So welcome to our seminar on options for strength, balance, and staying out of pain. So we're delighted to see so many of you here today. So looking to explore strategies and how to enhance your well-being and quality of life. So with no further ado, I will ask our panelists to come up and take a seat. And Miss Carly, and I'm not sure the order.
No,
we have to
remember.
It's okay. All right. So, Carly,
Yes.
let's see if this microphone is working.
Hello.
Nope, flip it.
Hello.
Hello? Hello? There we go.
Hello.
All right, so why don't you introduce yourself and tell us a little bit about you and why you're here today?
Sure, thank you. I'm Carly Snyder. I am here today representing the Arthritis Foundation. I do not work for them. I am a marketing freelancer, so I do not work for the Arthritis Foundation. I am on the local leadership board, however, and I participate in a lot of volunteer activities for the Arthritis Foundation, and that's why I'm here today. In addition, I was diagnosed with juvenile rheumatoid arthritis when I was 15. So that is my connection to the cause, and I do understand a lot about pain, and I talked with many of you before the session about getting moving and feeling motivated and things like that, and that's really why I'm here today. I get it, so thank you.
I am Dr. Jenny Crosby, and I've been a practicing chiropractor since 1991. I became a chiropractor because of my own chronic pain issues. I was given a wheelchair opportunity at 17. I avoided medicine until I broke my back in 2010. and have basically really followed my own path of nutrition, exercise as a way to keep quality of life. So I'm trying to remember how many years it's been now, probably 40 years that I have been managing chronic pain. So as a chiropractor, I understand that the word physician means teacher, so I always do a lot of outbound educational things. I think that it's really important that we give you guys ownership over your health and empowerment over your health. And so for me, this is just a natural progression.
Okay, thank you.
Hi, my name is Mike Falloway. I own OsteoStrong, and I'm here because much like their stories, I have a story too. I had chronic back pain for 10 years. I was fat, I was unhappy. Yeah, I said it. I was fat, I was unhappy. And I began running, and I realized that running made my lower back hurt. And what do us guys do? You guys are going to know. When it hurts, what do? You keep going. And I kept going, and it kept getting worse, and I was flat on my back. And so I found a solution. I fell in love with the process. I fell in love with you guys. I fell in love with aging. I fell in love with living a powerful life of physical freedom. So that's it. That's why I'm here.
Okay, thank you for sharing a little bit about your stories, and we're going to hear a little bit more about those as we go through this. So as we age, you know, our bodies are the big thing that we see that ages, and our ability to bounce back from injuries and illnesses, it takes us longer. And so limitations lead to pain, and as a result, we have a loss of independence. Today we're going to delve into some options and approaches designed to empower you in the journey towards greater strength, improve balance, and reducing pain. So again, our aim is to equip you with education and information, resources, and I want to thank you guys for being here today. I know they're going to be talking about their personal journeys, about businesses that they have, but we're really here just to offer information to you so that you know of the different options that are out there. So, all right, so let's get started. So Carly, I mean, you are not a senior.
Correct.
Okay, so you're young, but you've had years of experience with pain and physical limitations. So can you tell us a little more about your story?
Sure. So when I was in high school, I was an athlete, I was active, you know, like most normal teenagers, and woke up one day with a sore wrist. My disease activity started in my one right wrist. And over the course of a couple of months, finally, from enough complaining, my parents took me to the doctor because really I just thought it was nothing. I thought it was just, you know, I slept on it funny, I must have tweaked it, whatever. And the x-ray that was performed showed joint erosion already. And so they told me, you know, you have what's called synovitis at the time, which is the swelling of one joint. And over the course of about 3 months, that disease spread to essentially every joint in my body that you can get rheumatoid arthritis in. So I was left unable to walk. I mean, the two of you shared stories similarly, you know, unable to do physical, most normal activities, you know, being a teenager, literally like getting myself dressed, getting myself out of bed was something that my family, my parents had to help me with.
And so, you were how, 15?
15, yeah.
Okay, and can I ask how old you are now?
42.
Okay, so you've been living with this?
Most of my life.
Yeah.
Yeah.
Okay.
Yep. So really went from being independent to not being able to do anything. And with that, you know, you do start to look at, you know, is it going to be medications? Is it going to be nutrition? What are the factors? Why did this happen? How do I control it? How do I become active again? So a lot of that really ties into what we're talking about here today with exercise and keeping motivated, keeping moving. And that's, yeah, I mean, that's where we're at today. I've had many years that were controlled and good, if you will, and I have many years that were not. So there's definitely chronic pain throughout that entire journey.
So you were diagnosed with, it's juvenile?
Juvenile rheumatoid arthritis.
At 15?
At 15.
Okay.
Yep.
All right. So tell us, at what point in time did you, I mean, you're here sharing your story, which we so appreciate.
Yeah.
But at what point in time were you okay with sharing your diagnosis and your struggles?
Yeah, it took a while. So I don't know if any of you feel, uneasy about saying, gee, I can't, do this anymore, or I have trouble getting up, or I'm afraid to do X, because you don't want to fall, you don't want to be in pain, you don't want to be different. It took me till I was about probably 30, so it took me a very long time to feel confident enough to say in front of my peers or anyone that I have a disease and I can't do certain things, but I can still do other things, and how to kind of stay positive and stay motivated.
Okay. So did that, by accepting that, okay, do you feel like that defined you or limited you?
No, I mean, accepting is part of the process, and I think once you accept it, then you're fine with it, and you can, find solutions that work for you. I have no problem saying, if I'm in an exercise class or I meet someone, I have no problem saying I can't do certain things, but what can I do instead? How can I approach this differently? And I think, working with professionals like we have with Mike and Dr. Crosby and the things they're going to share today, that's really helpful in, feeling safe and secure and being able to, overcome and feel motivated and feel safe in moving forward.
Mm-hmm. Okay, thank you for sharing that.
Sure.
So let's talk about things we can do to improve strength. So, Mike, at what age do we start to lose muscle strength?
Well, that's a great question, and it coincides with this natural process of degeneration, which is really aging in general. And that's around age 30. That's where we can start tracking the loss of bone mineral density and the loss of muscle density in the form of myofibrils. We begin to resorb this tissue, and we're not creating as much as we're losing, right? We're not generating as much as we're losing. So it's around that age 30, 28 to 32 for most people. And for you sports fans, when do football linemen retire? Usually mid-30s, right? Well, there's a correlation between their bone strength and how physical they can be. And gymnasts retire at the ripe old age of 19 because of the joints, right? So the musculoskeletal system is so often overlooked in the aging process. We look for external factors, we look for other things, we look for disease. But guess what? Much of our issues, did I say that correctly?
Okay.
Much of our issues are related to bone and muscle degeneration.
Right. So I know, unlike maybe some of us in the room, Carly had a clear diagnosis, okay? I think a lot of you, me, maybe we don't have a diagnosis. We just feel like we're aging, and what can we do to combat that? So, so 30, that's pretty stinking young.
And I diagnose all of you right now as not being 30 anymore.
Let's see.
Okay.
One.
Now Mike over here is really close. He's barely over there.
If you walk backwards after you're 65.
Yeah.
Hold your questions, fella.
So, Dr. Crosby, can you discuss the importance of proper spinal alignment and posture for overall health and mobility in older adults? Yeah,
Sure. So I'll share this story about myself. I was a gymnast, and that's probably what put me in the hospital at 17, although I'd had sciatica in my right leg because of a malformation in my spine. And you can't lay me on a table that if I'm having a bad back day, my right leg is at least an inch short. And so if you're walking around like that with a deficiency of leg length, and you have ankle pain, knee pain, hip pain, back pain, you simply cannot recover. So I went to my gym yesterday morning, and again, this is knowing what you can do, and I said to my trainer, because I did 4 years of physical therapy and I've been with my trainer for 8 years, I said, yeah, I don't know what you have planned for me today, but we're not doing it. And so he worked with me, and then we did some very specific exercises to re-lengthen the muscles that cross my hip and my knee. I got most of my leg length back yesterday, and I will go get adjusted this afternoon. So that is my management program, right? So if you are walking around with a pelvis that's rotated, and that you can't have your pelvis rotate and not have one leg look shorter than the other. So we have what we call structural deficiency, which I have an 1/8 of an inch that's permanent. It's like one leg is shorter than the other by 1/8 of an inch. But I also get functional deficiency, which means that my leg can shorten up on a bad day almost an inch, maybe sometimes more. And so when you have that component and it's resolvable, it's identifying it and fixing it. So literally, you have both legs under you just right, and that's going to change how you walk and move, right? So a lot of times too, we adapt our movements due to pain, and that recruits muscles differently or asymmetrically, and so we have to undo that too. And if I've got a moment, I've got another story. I love this story. It's a patient who was a security guard at Chesterfield Mall. And I could not get rid of his shoulder and neck pain. And I would say to him every time he came in, you've got to be doing something, right? We can't get more than 2 weeks and then you're out again. And this shoulder is high and these muscles are all tied up. And he's not on a computer. It wasn't that he had mouse arm, because we get a lot of that too. I'm like, what are you doing? And he says, Doc, all I do is walk. That's my job. So one day I'm at Chesterfield Mall when they still had stores there, and he was wearing this baton on a belt, and in order not to have that baton rub on the inside of his arm, he's walking. He's walking with his arm like this, right? So we could adjust him forever and ever and ever, because as long as he's walking like this, it's going to come back. So sometimes it's a posture you get into sitting in a chair at home, or a task that you're doing repetitively, like him walking like this. Sometimes it's habit patterns that your body has set up because you have minor curves that are permanent. But those things, if we work, we may not correct it entirely, just like my leg length isn't correctable entirely, or his job isn't going to go away. But now he can start moving the baton to the other side and sharing the work on the other arm. So there are little tricks and things that we can give, small fixes, right, to make quality of life better and get more time between those postural alterations showing up. So that's kind of what we do. And then if that's not working, then we look at why isn't it working, right? Why can't we get there from here? Are we missing something about the work environment or the home environment? Are we missing something nutritionally? Are we missing something with the blood sugar? What are we missing? Because everybody should be able to heal and get rid of inflammation. Okay?
Can I add something?
Yeah.
So I think what's important there, and tying that back to osteoarthritis and pain and joints, we do overcompensate with how we sit, how we move. If your knee is sore on one side, you're going to sit differently, you're going to walk differently, you don't even know you're doing it necessarily. And that's where this kind of stuff is very important, because you have to sort of recognize that as someone in pain, that just doing your daily activities, you are sort of off because of the pain. So just kind of knowing that, I think, goes a long way.
Piggyback one more thing on. Sometimes when you're hurting, because of all that compensation, the last thing you want to do is exercise. And yet it is the first thing you need to be doing. So sometimes for us also, it's managing the pain as we reintroduce motion. Because if you don't have motion, you're just going to lose ground much, much, much more rapidly.
Right. So this morning, I didn't know mouse arm was a thing. Did anybody else know that? Maybe that's what I have.
Oh, tech snack and mouse arm, I tell you what.
So yes, I'm having a shoulder arm problem, and quite frankly, I could hardly lift my arm this morning, but I was forcing myself so that I could actually move it. Yeah.
Personally, I love it when patients come in and they're complaining about neck pain, right? And we take care of them, we get them adjusted, we work out the muscles, we do whatever we need to do. And then while they're getting one of our passive therapies, that phone comes out and they're like this. And as soon as that head goes forward, the weight of it, which is like 8 to 10 pounds, the weight of it becomes 20, 30 pounds, right? Think lever system, physics. So as soon as they start doing that, they are undoing everything we did, just like the guy walking like this, right? So computers, even if you guys are, I don't know, my dad loves to watch YouTube all the time. So if you're mousing, but you've got this thing set up, yeah, okay. So he's telling me, you gotta get off YouTube. But if you're mousing and you don't have your monitor isn't at eye level, if you're looking down, stick a book under it, stick 2 books under it, get it to eye level. If we're wearing a bifocal and you gotta do this with your head, then lower it, right? Get it to where you're looking at the...
That's a tough thing, figuring out.
Oh, bifocals, they get all sorts of upper neck pain because they're looking up like this all the time, right? That micro movement. And so, but then the arm should be rested on something. It should not be a floating arm the whole time. So we saw a lot of that when people started to work from home during COVID.
Yeah, and I'm wondering, I know we're all in the older except for one person here, who happens to be my daughter, so she grew up with technology, and oh my gosh, people that are younger are just, I don't know, I'm just curious, do you see more younger people having a lot of issues?
Yes. I mean, I'm going to say that they don't get enough activity. They're on flat screens all the time. They drink soda, so you're talking about bone density loss starting in the 30s, but I'm going to tell you, like, you have your highest bone density in your early 20s, and if you're drinking even 1 soda a week, that sets you up for bone loss even in your childhood and teen years. So I have been the radical doctor who's told patients for 30 years, if you're going to give your kid a soda, give him a cigarette, because if you're going to set him up to fail, you might as well make it a home run. So my kids never got soda. It is a non-food, posing as a food. It has no redeeming qualities to it whatsoever.
Okay. So Mike, talk to us about what we call, or you call, bucket fillers in regards to nutrition and also holes in the bucket.
Right, so everybody hold your bucket, imaginary bucket, right? What are you going to put in there? You're going to put in good stuff, right? You're going to put in nutrients. You can let your buckets down. So you've got this imaginary bucket. What do you put in the bucket, right? So Dr. Crosby can guide you even much more expertly, but here's how I like to say it, because I have to keep things simple. Essentially, this is a hat rack up here. So you put the good stuff in, right? All that stuff you learned in 3rd grade. You know, get your vitamins, your minerals, get some exercise, drink some water, get some rest, all those good things in your life. Those are your bucket fillers, right? You got to get some sunlight, get your D. You need some C, some calcium, magnesium, zinc. Evidently, I'm zinc deficient. I just found out today. But those are the things you put in the bucket. But we have these things that make holes in the bucket, like soda. Twinkies.
Pop-Tarts.
Thank you very much. What did you say? Pop-Tarts. Smoking alcohol, yeah. You know, we've heard forever, a glass of wine a day is good for you. Rubbish. Sorry.
Well, that's your opinion.
Controversial, I know. Little did you know you were going to get... Anyway, but those are the holes in the bucket, right? So remove those things, patch those holes, stick the chewing gum on those holes so that the good stuff that you're putting in can remain in and be functional. You know, if you take the things that are good for your body and you put them in your body can do good things. Your body wants to heal. God did not make mistakes. Your body wants to heal and to grow. But we also know that we can do things to trigger the usage of these. Let me give you an example. All the things you need to make bone density. You know, you need D, you need calcium, potassium, magnesium, you put it all on a table like a fudge table, right? And you blend it all together. You ever seen them make fudge? You know, on the table? You scrape all that stuff together, right? Well, imagine all that's happening. You're putting all that together. But if you never use that, if you don't trigger the usage of it, here's another example. You get some peanut butter, throw it on the table, some jelly, throw it on the table, some bread, and a knife. You got all your ingredients out. And, you know, a lot of people say, well, I got a sandwich. No, you don't. You have ingredients. Thank you, Helen. Helen doesn't like peanut butter. Well, make a bologna sandwich. So you put all the ingredients on the table, but unless you make the sandwich, Unless you put them together, you don't make a sandwich. All this stuff in your body, you need to use your body. You need to trigger the usage of the stuff. Exercise, put pressure on your bones. You need to do the things to make the ingredients happen.
I want to piggyback on that. Yeah. So you want to use that sandwich, right? You make the sandwich, and hopefully it's all whole food, because I always tell my patients that if it doesn't rot, it's not food. It's non-food posing as food, be clear. So if it can sit in your cabinet and last for 3 years, it's non-food posing as food. So, but you put that food on board, and then you want to be able to digest it, right? And God created us to make acid in our stomach for a reason. And that is to kill bugs dead on the way in, but it's also to start the process of breaking down protein. And you need protein from muscle. You need the amino acids from protein to build muscle. So if you don't have enough acid in your stomach, you cannot break down protein. That's the first step. But then the food goes through your stomach and it becomes this liquid, we call it chyme, C-H-Y-M-E. And that liquid goes to your small intestine, and that's where you absorb the B vitamins you need for neuropathy and for all nerve function. That's where you absorb the critical micronutrients like boron and calcium and magnesium that you need for bone. And when it hits your small intestine and it's not acidic, you can't absorb it. So gut health, how you digest and absorb food, is just as important as the food that you're eating. And that's one of the things that we look at when people can't heal.
Yeah. So Dr. Crosby, I know that you work with functional medicine. Can you talk to us about what that is and how it affects physical health?
Sure. So again, if you are unable to break food down properly, then you can't use the nutrients from it. And that's making the assumption that you're eating real food, right? So that's one of the things we'll look at. As we age, we produce less acid, not more acid. Now, how many of you have had doctors who've told you need to be on something to stop acid? Okay. You know, those proton pump inhibitors were designed to help with ulcers. They stopped acid so that your stomach could heal when you developed an ulcer, right? And we developed ulcers because we were using antibiotics. So you go on a proton pump inhibitor, but you know, if you read the small print, you're only supposed to be on them a short amount of time.
So what is an example of a proton inhibitor?
I'm going to blank on names right now.
Prilosec.
Prilosec, thank you.
Nexium.
Nexium. Yeah.
Okay, so
Yeah.
all those acid
All of those
reflux
acid.
things.
So
Omeprazole.
how many of you have heard the miracles of apple cider vinegar, right? How many of you have actually taken apple cider vinegar and felt better? Right? Okay, do you know why? Because you added acid to your stomach. So mostly, when I start with patients, that's a very foundational place, is to look at, if we take you off of your prescription proton pump inhibitor and you're having heartburn, if we add lemon juice or apple cider vinegar, does it make it better? And if it makes it better, then you needed more acid, not less. And now we can actually start you to digest food in a different, more effective way, so you can heal better. And in the meantime, we might band-aid you with some really, really good bioavailable supplements, because one a day is not it. Centrum for seniors is also not it. Okay, I'm gonna ask a question if I have time.
Sure.
If I gave you a plate of broccoli, a glass of milk, and a plate of chalk and said consume your calcium, who's going to consume the milk first? Okay, that's calcium lactate, and you would get calcium from that. Who's going to consume the broccoli first? Okay, some of you know that you get, yes, broccoli is a calcium citrate, right? So calcium lactate, calcium citrate, both look like food if they're in a product. So that chunk of chalk, are you going to eat it? Okay, wait a minute. I'm going to grind it up. I'm going to make it into a powder. I'm going to put it in a supplement. You going to eat it now? Do you think you're going to absorb it? I mean, innately you know you don't need chalk, right? Innately you know that. Okay, it's kind of gritty in your teeth, but it's a rock. So when you get a supplement, they're not all created equal. 500 milligrams of calcium carbonate is not going to be as available to you as 500 milligrams of calcium citrate or calcium lactate. Does that make sense?
Yes.
So we're gonna band-aid the nutrition as we're fixing the gut so that we can start healing. But the other thing that I'm gonna mention is after the Industrial Revolution, we started to eat more grains, more sugars. Before the Industrial Revolution, we ate 4 pounds of sugar a year, and now the average American eats that much a week. And if you want to know the number one reason that your inflammation doesn't go away, the number one reason, sugar. And there's not a doctor out there having this conversation on a regular basis because you can't make money telling people not to eat sugar.
So, Carly, do you limit sugar? Is that something that you've done?
I do. I actually usually do a gluten-free diet, or at least to the best of my ability, because yeah, I mean, I think grains and sugars and stuff, I mean, what they're both talking about with gut health, I found that really was a huge thing for me. My stomach would be very upset, my ability to, I'd be lethargic or feel kind of fatigued. And as I cleaned up my diet and started to limit some of that stuff, it does make a difference. Did my RA go away? No, but I felt better. And then I was able to do things like move and feel motivated and, kind of continue to gain strength, gain muscle, feel like I'm participating and I'm happy in society, right? So that's where I think the gut health stuff really can make a difference.
Very interesting how everything is really interconnected. And I guess so important to evaluate what you're first putting in your mouth to nourish your body with. So, all right, Carly, so you mentioned about strength. So decline in muscle strength tends to accelerate after the age of 60, with some studies indicating that grip strength, for example, may decline around 1 to 2% per year in older adults. So I know yesterday at the senior fair was giving out jar openers that I give out, and a lot of seniors say, oh my gosh, that's great, I need one of those. I use mine all the time, in fact, but I don't know, because I'm 60 now, huh? But anyway, so strength in seniors is so important and affects many aspects of our life. It affects mobility, independence, your bones, chronic disease management, mental well-being, longevity, and quality of life. So, Mike, talk about how OsteoStrong helps seniors improve their strength.
Sure. It's really simple. We help you increase your bone and muscle density. Mic drop. That's it. It's that simple. But all kidding aside, as we lose this structural integrity in our musculoskeletal system, that's the key, right? We need structural integrity. Any engineers here? Okay, Gary's wife made him promise not to talk during this talk. So. Thanks, Gary's wife. Structural integrity. If I came by you build a brand new house, right? I come by your house once a month, and I just grab 1 2x4 out of the middle of your wall. No big deal. For how long, right? 1 2x4. And I do this every month for the first year. I've just taken 12 2x4s at random out of your house. You're good, right? No sweat. Year 2, year 5, year 10, year 20. That's your bones. Your house is failing unless you take care of it. You keep putting in those 2x4s, right? It's the holes, right? So I hope that resonates with you. And I want to give you hope. You can regenerate bone and muscle tissue so your body can perform better. You can. We work with people as young as 13 and as old as 97 currently in our centers. Now, I want to tell you that cases of osteoporosis are being diagnosed younger and younger and younger and younger and younger every year because of this texting, because of video games, because kids aren't running and jumping like they used to. How many of you, like me, in the summer, you got up at 6 in the morning, had breakfast, left on your bike, and came home at dark?
Yeah, with the street lights.
Because if you were at dark +1, you got your butt beat. But you got home at dark, and your parents didn't really care because the community took care of you, Joey's mom brought you home if you skinned your knee. Those kind of things, right? You were out doing stuff. Those days are over. Osteoporosis is being diagnosed at 10, at 12, at 18. You guys, after about age 30, you women, had begun losing bone mineral density at the rate of 1.5 to 2.5% per year. The average for a white woman. It is race dependent. Come to age 50, on average, menopause hits. By then, you've lost, on average, 40% of your bone mineral density. You're at a 60% level. And then, as a bonus, in the 5 years post-menopause, the average of you lost another 25% of your bone mineral density. So you're at somewhere around 35-40% of your bone mineral density that you had at age 30. And you wonder why you do this, right? Well, you can regenerate that. So, there's hope. You can do it. It's easy, simple, pain-free. We're not supposed to market here, so that's all I'm going to say. Just...
So they have a picture, a slide of some machines that you have that help feel strong.
I'm sorry. So what you can do is you put pressure on your bones. And I was having a wonderful conversation before we started. We've known forever that weight-bearing stress is the best thing for your bones, right? Nod your head if you know that. Okay. Well, we didn't know until about 20 years ago, 18 years ago, how much pressure is necessary. So we have about 700 men and women who come to us every week and do this stuff. And they put tremendous pressure on their bodies without pain or sweat. But here's what we know. Probably 200 of those men and women were lifelong gym rats, heavy weight-bearing people. They go to the gym and they bench press and they squat and they do all this stuff and they still got osteoporosis. Your body requires more. And that's what we do.
So can you explain the scientific principles around this?
Yes.
I guess I'm not really correlating how...
Okay, I'll make this one quick.
Okay.
My wife says I get verbose. Forgive me. She says I gesticulate. I don't even know what that means. Anyway, in 1892, Dr. Julius Wolff discovered that if you work hard and put stress on your bones will be denser and stronger than people who don't. Ranchers, farmers, cattlemen and women, right? Loggers. When they died, he would saw their arms off and just look at the cross-section. Wow, he's got strong bones, thick bones. Bankers, doctors, lawyers, housewives who, of society who didn't work, lop off their wrists and look at their bones. They're very sparse. So he postulated, and it was discovered, and it's a law. Wolff's Law says that by putting pressure on your bones, they can remodel, they get stronger. Fast forward to, in the last 20 years, we've discovered how much pressure. But that's why doctors have always told you, weight-bearing stress is good for your bones, go to the gym. Some ill-informed doctors say, walk, and you'll help your bones. Rubbish, you don't. 0. 100% rubbish. Doesn't help your bones. But it's Wolff's Law, and it's pressure in what's called an axial load. That means this way. Putting pressure this way on your bones, insufficient amounts.
And that's what those machines
Yes.
do? Okay.
And I'm going to say, gentlemen, for those of you who heard all that information about women losing bone, don't worry, you catch up. By the age of 75, it's net
Playing field.
level. Just saying. The walking, it's not effective for creating bone, but it is effective for balance and for heart health.
I was
So-
only specifically talking about bone remodeling.
Yeah.
Walking is paramount for overall health.
Okay,
But
thank
not
you
for bone
clarifying.
development. So our bodies regenerate, all different tissues regenerate. When I work with functional medicine, I know that I can see a change in red blood cells and what they look like. inside of a month because we turn them over every 30 days. Anybody want to guess at how long it takes to turn over bone? Raise your hands if you think 1 year to turn over bone. 2 years? 3 years? 4 years? 5 years? 6 years? 7 years?
Okay.
8 years? Okay, I cheated. There's only one person in the room who was right. 7 years. Woo-hoo! So this requires intention and repetition.
So when you come into our center and you do one session, and you go straight to your doctor and do a P1NP test, you see a dramatic upregulation of osteoblastic activity in your blood. One session, your life's not the same anymore.
Are you saying that's a good thing?
Yes.
Okay.
And it's a good thing. I mean, look at my face. Is it bad? It's a good
I just
thing.
wanted to make sure that, most of the time we're,
That's good. That's what makes the new bone.
Okay.
So osteoblasts are when you form bone, and osteoclasts are when you break it down. And the idea is to have a higher ratio of making it versus breaking it down, right? So that's why he's so excited. I get excited because whereas a medical doctor will do your DEXA every 2 years if you're osteopenic, or every 1 year maybe if they're concerned about osteoporosis. I can do a DEXA for about $35 at Logan every 3 months if I want to.
What's a DEXA?
A DEXA scan is a way to look at what's happening in the bone and how dense it's getting. So if I've got somebody who is not doing well with activity, and then we change their diet and nutrition, I can do blood panels to make sure they're absorbing all their nutrients after I've worked on gut, and then we can actually do a DEXA every 3 months to see if we're moving the dial in the right direction. Then when we've nailed it, then they could just stay on that path. So
I have a question. So this is like new information to me. How many of you know that are tuned into this kind of stuff? Anybody besides Sharon? Tom, a little bit.
So have you guys had bone, anybody in the room had a bone scan to look for osteoporosis?
Oh,
Yeah.
Okay, yeah.
Yeah, that's what we call the DEXA.
So what do most people, when you have this scan, what do they say to do? Take calcium?
Take medicine.
How many of you have been prescribed, who have had a bone density scan, have been prescribed a bisphosphonate or an anabolic drug, Beniva, Fosamax, Prolia, something like that? Those drugs will help you get denser bones. But for instance, the bisphosphonates only work on the cortical bone. They don't work on the trabecular bone, the outer bone. There are some, see me afterward. But suffice to say, let me just put a pretty bow on it, right? Y'all have less bone density than you did when you were 30, and that's part of the reason you're old, okay? Let's just face it.
Yeah.
But there's a light at the end of the tunnel, and it's not a train. And it's all this stuff that these experts are sharing.
I want to say something. Okay, so again, about that bone. Prior to having, if I can intervene before my patients go on some of these medicines, the first thing I'm going to do is test for vitamin D. Because even if your digestion is great and you're absorbing all of those critical micronutrients, if you don't have D, which is the glue to hold these minerals in your bone, if you don't have it, you can't stick it in. So again, when people are unable to be effective at improving bone density, that's probably the #1 thing that they're deficient in. And sometimes when they're so deficient that they actually have bone pain from vitamin D deficiency. So sometimes just getting that vitamin D on board is just enough to switch gears and get them moving in the right direction.
Okay, so Dr. Crosby, oh, sorry, did you want to chime in?
Nope.
Okay. All right. So how can chiropractic care help someone who needs to improve their strength?
I have 2 types of patients who come in with chronic pain, but they all need strength training. They all need to change up strength. If you got chronic pain, it's fairly inevitable. We had this conversation on the phone. If you put your hands on your shoulders or your arms, scoot your chairs back. Are you able to go from sit to stand without using your arms? Right? That's strength, guys. So if you can do it, that's awesome. That's awesome. If you can't do it, then that is something that in our office we would work with you on. Because if you can't do it because of hip pain, then we need to resolve the pain so we can get you doing it. If it's knee pain, we need to work on that knee pain so you can do it. If it's an ankle problem, wherever it is, right? So there's two types of patients. The ones who say, I hurt too much and I won't, or I hurt but I understand this is important and I will. And the ones who do the work actually show the best recovery outcomes. So if we can add the exercise, even though it hurts, if we can add the exercise and continue to work on reducing the pain, we're going to get a faster response, because when we start placing demand on that hip or that knee, even though it hurts initially, their brain is now paying attention differently because we're placing demand, and so the healing response starts to improve.
So, Carly, I know you started talking about the mental,
Yes.
and I know you had some great thoughts and actual experiences about that. So share with us about
Yeah.
the mental.
Yeah, I mean, I think with anything, there's physical pain, but a lot of chronic pain is also mental, right? And it makes you feel bad. Like, if you couldn't stand up just now, you probably felt a little bit bad about it, right? So there's a mental trigger that's associated with not feeling like you can be yourself or do what you used to do. So for me, I mean, I find building the right community is extremely important. So, I mean, even look around, like, this group is a community of people that are going through very similar things. I stopped at different tables. You guys might not know each other, but you're all saying the same thing. I'm not motivated. I used to work out, now I don't. I need more information. I don't know how to get started. My hands hurt, my back hurts. You guys all have very, very similar challenges, and forming that community can help, right? Helping each other, just sharing ideas and not feeling like you're alone goes a long, long way. Another thing for me, I am on the board of the local Arthritis Foundation. I am very active in local events that we hold, seminars, webinars, podcasts. There's tons of free activities that the Arthritis Foundation puts on, whether it's on their website or in person here locally at various locations around the St. Louis area. And again, those kind of things, it makes you happy to participate. It gives you endorphins. It gives you, it changes your mental state if you're out there with other people and laughing and smiling and helping others. It really does make a big difference in terms of feeling motivated. So I think, the mental side, it is very, very important, and it can trigger you to then help the physical side.
Okay, thanks for sharing that.
There is a slippery slope here that the neurotransmitters associated with depression are impacted by pain. So sometimes breaking the cycle of feeling like you can't or you don't want to, like literally that first push to get out and start doing it is the hardest step to take, that very first step, because you're overcoming like literally the neurotransmitters in the brain, which are now saying, yeah, we can't, right? So again, it's what's better than any antidepressant, hands down, all the research. You can look at any research, National Institute of Health, hands down, you put any antidepressant up against exercise, exercise is going to win every time, every single time.
And, I like to think about it as combining. I know we sort of talked about this, three of us on the call, but combining the physical with the mental side. So, she talked about overcoming that first step. Well, maybe work with someone, your spouse, your friend, your child, whatever it is, someone that you trust, and hold each other accountable. Go for a walk together, talk, call someone while you're on your walk. Go outside and garden, even if it takes you longer than it used to, even if it makes you feel a little bit, you can do it. It's just a matter of figuring out the ways that you can do it now that works for you. But combining it with things that make you smile and make you happy will help. Put on music and dance for 10 minutes in your kitchen before dinner. I mean, it will make you smile, and you will also be exercising at the same time.
I'll tag that. 2 things. 1, tell yourself some dad jokes. Those always help. And 2, think about back when you were 16 years old and your mom and dad. Let's just daydream for a moment. You're 16 years old and it's your birthday. And your mom and dad say, I've got something great for you. We've been wanting to give you this for years. Here it is. It's your brand new car. It's your dream car. It's the one you've always wanted. What's your dream car at 16?
16, Thunderbird.
55 Thunderbird. I thought he was going to say like a 35. Sorry. I love this. 55 Thunderbird, gorgeous car. But guess what? There's only one catch. It's the only car you're going to get for the rest of your life. How do you take care of that car? You wash it, you wax it, you rotate the tires, you put the right fuel in it. Any pilots in here? Okay, you don't put diesel in your airplane. You put Jet A or 100 low lead, right? You take care of this one car, right? And that's how we have to think of our bodies. You get one body. This is the one God gave us. And guess what? It's not too late. There's hope. There's a light at the end of the tunnel, and it's what? It's not a train.
I like to look at it too of like setting goals. So many of you probably either you still work or you worked, you had a career, we have an engineer back there, you're black and white, it's goals, right? It's very specific things. So even try to set yourself a goal of having 3 regular foods a week. Like transform a couple products that you maybe are eating that you shouldn't be, and then you build upon it. Or, by the end of the week, I'm gonna walk X amount of miles or steps, or I'm gonna get up and move 3 times. Like, make it achievable and then build upon it. But I think having that motivation, for me, like I'm very goal oriented, so it helps me to say like, okay, by the end of the month, I'm doing X, and I can measure it, and I can see, did it help me feel better?
For those of you who are cell phone savvy, I use my Fitness Pal on the phone. I give it to a lot of patients. It's free. It's a free app. And we'll have them look at their sugars, and we'll have them actually journal everything they consume, food and beverage, right? So we can start making subtle shifts. So oftentimes that first big step is giving up the 6 or 8 sodas a day they might be drinking, which I do see that. I do see that. I have a story about a personal trainer who went to 4 neurologists because his hands were sweating, and he was drinking 8 Mountain Dews a day. So I told him he needed to give up soda if he was going to be my patient, and I never saw him again. And I thought, well, I ticked him off really well. But about 1.5 years later, he sent me a patient, and he said, yeah, you cured him in 1 visit. so that's why he never came back. So, okay, good to know. But so you use things like MyFitnessPal, right? And track, or there's carb counters you can buy where you can track your sugars. But I want to do this little thing, and I've done this with high schoolers, and I'll tell you how you compare in just a moment. Okay, everybody stand up. Okay, sit down if you eat 1 or none fruits and vegetable servings a day, and I'm not counting French fries or ketchup. So if you only eat 1 fruit or vegetable serving a day, sit down. 1 or less. Okay. What about 2 fruit and vegetable servings a day? Sit down if you max out at 2. Sit down if you max out at 3 fruit and veggie servings a day. Okay, those of you still standing, you're 4 or more, right? Let's keep going. But look around the room at how many people are getting 4 servings of fruits and veggies a day. Sit down if you max out at 4. Sit down if you max out at 5. Sit down if you max out at 6. Okay, 6 servings of fruits and veggies, right? Nobody in the room's doing it. One, okay. So the food pyramid set in the 1980s has driven us towards diabetes. It has driven a third of our patients to diabetes, and that's inflammation in all joints that will not go away. Mayo Clinic has a food pyramid that puts 7 to 9 servings of fruits and vegetables as the base, and then grains, and then meats, right? So the Mayo Clinic version is the food pyramid I use with my patients. Now, how many servings do you think the average high school student gets a day?
0.
I had 4 classes of 25 students per class in my office. And in 3 of those classes, I had 1 student who got 3 servings a day. And only in 1 class did I have 1 student who got 4 servings a day. So they're not getting the nutrition they need. You guys are getting more than they are. And still, it's not enough. So if you substitute fruits and veggies for some of the things that come in boxes and bags, your joints will feel better. They will feel better. And that's a good start right there.
Everything with that? Okay. So, so strength training, and strength training. It's strength training. Not the kind that you're just going to consistently lift weights. And
I advocate everybody do what you can with strength training. We don't do exercise at OsteoStrong. So if those of you who hate exercise, you're going to love us.
so are you going to bring a sweat?
There's no pain, there's no sweat. What we do is wholly different from what a gym does. And I'll spare the technicality of it, but I want you to exercise. But we're not an exercise facility. We are a robotic musculoskeletal tissue regeneration center. We help you create more bone and muscle tissue so that you can go out and live your life and exercise better and be healthier. We're step 1. The gym or your community, exercising is step 2. Do those functional movements and exercise. By all means, all that you can safely. But that's not what we do. We help you regenerate cellular level tissue.
So while you have the mic,
Yes.
okay. So are there other places that do this?
No.
I don't know.
No.
So I don't know the answer to that.
This is patented technology just for OsteoStrong.
Okay, fair enough. Okay, what does OsteoStrong cost? Is this something that, you're advocating that you start doing and it is a lifelong thing?
Great questions. I'll answer that one first. As you regenerate tissue, it takes a long time to lose. Remember, it takes you sometimes 20, 30 years to lose all that bone density. Maybe it takes you a year or 2 or 3 to restore it with us, but then it's going to take you another 20, 30 years to lose it again. So that answers that question. But some people do come to us because you keep getting stronger. Now, what does it cost? We do have insurance options. We work with United Healthcare and Aetna Insurance. And outside of those, our memberships are about $149. They begin $149 a month. And there's an enrollment fee, but if you guys mention this, I'll pay the enrollment fee of $99. I'll pay that for you if you mention that you were at this class. But starting at $149 a month. Or there are insurance options that'll get you down to 0.
Okay, so can you go in and try this?
Yeah, we offer a free session. We'll set up a consult call, and then we offer a free session. Try.
Okay, all right, okay, thank you so much. Okay, so anything else, Dr. Crosby, you'd like to talk about strength and chiropractic, and then we're gonna talk about balance.
So I'm going to recommend all the things that he didn't recommend. I'm going to be the one who says, I'm going to take away your sugar, I'm going to add your fruits and veggies, I'm going to make you do exercise. And if you need, I'm going to help evaluate for the type of exercise that's appropriate, because a good exercise in the wrong situation becomes a bad exercise very rapidly. So I'm going to evaluate for that. I'm going to have you doing home exercise, or if I feel it's necessary, I'll refer you out for physical therapy. Or I've got a guy I referred out to a trainer, and he's just going to town right now. He's in his 80s, and he's doing kettlebells and all the rest of it. But first you gotta get the pain gone, or pain at least under control, right? And start with some foundational stuff. We haven't really talked about balance, but balance is big for me because of fall risk and just quality of life deterioration or risk of mortality even with falls. So that's a really big deal, is looking at balance and trying to even get you started on some basic foundational balance exercises.
So CDC says 1 in 4 Americans age 65 and older falls each year.
Yes.
That's a lot.
And so, sometimes it's the fall creates the fracture, sometimes the fracture creates the fall, right? So, but we want to avoid both of them by adding bone density, by adding exercise, by creating better balance. So these are all things that matter, especially if there's neuropathy, right, and you don't know where your feet are. I was saying at one table that I was absolutely terrified when I broke my back and lost both legs. I was absolutely terrified of fall risk because I see the results and the outcomes of it every day. So for me, the idea of not just going, I paid my physical therapist to be my personal trainer for 4 years because I could not stand on one foot for 3 to 4 seconds for almost 4 years. But I went 4 days a week. I spent the money because it was the best investment, the best gift I could give myself. And it made me accountable because he was looking for me to show up and I was paying him whether I was there or not. So now I'm with a trainer, and after 8 years I got smart. I've now roped in a few other people to come to my trainer on my sessions. So, but again, I am paying somebody to show up. And so that I'm not going to waste my own money because that's a gift to myself for my health, right? So going to physical therapy or to a trainer, at least temporarily, while you get accustomed to doing workouts at a gym, even if it's just once a month, just to tweak your exercises. However, it needs to happen. And then if there needs to be guidance because of a bad hip or bad back or something like that, then it's evaluating to figure out what's appropriate for your needs.
Yeah, I have something real quick. I can't overemphasize what she said. She's so right about the balance. There are 3 pillars to fracture prevention: strong bones, strong muscles, and balance. If you have better balance, you're less likely to fall. If you do fall, if you have stronger muscles, you can better decelerate before impact. And if you have strong bones and you have an impact, you're less likely to have a fracture. And here's where anybody who has a diagnosis of osteoporosis or osteopenia needs to really pay attention. 1 in 3, 33%, according to American Bone Health, which I'm a peer educator, states that 1 in 3 hip fractures result in death in the first 12 months. 33% mortality rate, which is right up there with heart disease, right? So balance is the indicator, and there was a study done in Brazil 2 years ago on balance, and it stated that if you cannot balance on one foot for 10 seconds, you have an 87% higher chance of dying in the next 10 years than someone who couldn't, because of how balance plays into your overall health.
Carly wanted to add something in there.
Yeah, so I was just gonna say, I mean, I think they're emphasizing it very well, but like being safe is extremely important. So if you don't feel like you wanna go to a physical therapist or right, like if you're sort of sitting there thinking like, I don't have the money for that, okay? That's legit, that might be happening. But remember what Dr. Crosby said, maybe it's just a couple visits, maybe it's once a month, maybe it's going to a session with Mike and just making sure that you are aware of the safety aspect of balance and things like that. At the Arthritis Foundation website and things, there are a lot of videos and exercises and things that you can do at your home on your own, but you have to make sure you're doing them correctly and safely. So just, you'll want to sort of evaluate your own body, like where you're at. If you feel like you could probably do it and you'd be okay, then that's one thing. But if you are already feeling a little bit shaky or off, you really may want to invest in going to a center or finding someone you trust who can help you with getting that back.
So, and we put together a list of several things that can affect your balance. So, age-related changes, okay, we're aging every second, right? Muscle weakness, bone weakness, medication side effects, joint stiffness. You're all nodding your head, so I'm guessing you're agreeing with this. Foot problems. We talked about neuropathy, right? Neurological conditions and lack of physical activity.
I had 4 years where I didn't know where my feet were. So to climb stairs, I had to look down to see where I was putting them, right? That happens a lot with neuropathy. I had it because of spinal cord damage. And so, again, I would go to my physical therapist. He was on the second floor, and part of my physical therapy was climbing those stairs and learning not to look at my feet. So, right, the easy answer, take the elevator. The hard answer, hold the rail for balance, be prepared to trip, go slow, and make it up the stairs. So, but Carly's absolutely right. When I evaluate in my office, if that's not appropriate, or sometimes I have people on blood pressure medicine and they have sit to stand, their blood pressure will bottom out and they're going to pass out. So we have to look at what's going on and what's appropriate. For some people, working on balance is as simple as holding a wall, holding a chair, holding a table, and learning to raise one leg and not look at the floor. Right? So we put a little sticky note on the wall, they look at the sticky note, maybe it's a smiley face, maybe it's you can do it, and then they 1,000, 2,000, 3,000, and it's just raising the leg and holding the wall. It doesn't have to be high tech. It's like the sit to stand we just did. If you have to spend 10, 15 tries just doing squeeze the buttocks, get the legs ready, and prime and try to go, and I couldn't get out of a chair for a couple of years, right? The key is don't give up, right? The key is don't give up, keep trying, squeeze the buttocks, get the legs in, and then up you go. Eventually, you'll make it. You used to be able to. You have the muscle memory, you just need to place the demand.
Wow, okay, yeah.
Recruit the glute, right?
Recruit the glutes, okay, use it or lose it. Yeah, correct. Yeah. All right, so, and do you have balance issues with arthritis?
With arthritis, yes. For me, not really I don't really have a ton of balance issues right now, but I've had a lot of, when you're in severe, like if I'm flaring or I have, a joint that's really acting up or multiple, yeah, I mean, it can throw you off your balance for sure.
Okay, so what is a flare?
When you get swelling in your one or more of your joints, that can be caused by all sorts of reasons. I was showing someone earlier, right now my problem joint is a very unfortunate one. It's my middle joint, so it's kind of fun to show it off, but it just won't go down. So yesterday it rained all day, and I don't know if maybe that's why, but this morning I woke up, I was like, oh, this is fitting for today's conversation.
So what kind of pain do you experience with rheumatoid arthritis?
Very similarly to osteo. I mean, it's aching, it's swelling, it hurts. I mean, to touch, it hurts. Gravity hurts, I mean, even just sort of moving your arm and now it's facing down and my finger's starting to throb. I mean, it really, it's a chronic, it sort of doesn't go away. For rheumatoid arthritis, at least, I don't know as much about osteo. I don't know if it goes away throughout the day, but rheumatoid is really bad when you wake up in the morning, and then kind of as you go throughout the day, it tends to kind of level off a little bit. But it's just kind of it's very limiting. Like we talked about, you were mentioning earlier some of the things you can't do, but in my hands, it's my worst in my hands and wrists. So you have to find alternate ways to open things, to lift things. One of my first cars, I had to have a push start because I can't do this motion very well with a key. So it's like you pay more, but it gave me a heck of a lot less anxiety in the morning. And again, physical tied to mental. It's this cascade of you're afraid that I don't want to go start my car, so I'm going to pay extra to do that if you can. But I don't even know why I said that. I don't know how I got here. But it is important, yeah.
It's true, because anytime you have chronic pain, you have to learn to adapt, right? You definitely learn to adapt, but you also figure out, okay, I can't drive that car, so I'll drive this car instead. I can't sit in that chair comfortably, but I can get in my recliner and angle back. Right? I can let the recliner sit me back up, right? In fact, some of them even stand you up these days, right? Okay, and that's a comfort thing, but is it a good thing? No, because then there's no demand being placed on your body.
So just out of curiosity here, raise your hand if you experience some kind of pain on a daily basis.
Now,
Most of us are.
we know you've lived a good life, because the person who gets to be in this room at this point in their life and who's never had pain has not lived.
You're
All right, so we are getting really close to time, and there's so many questions I didn't get to ask you all.
I would like to address with chiropractic. I mentioned it to this one table, but I was asked how much it costs, and it's going to be a soapbox moment. We've been covered by Medicare since the 1970s, but we were still considered part of the anti-quackery campaign, so they had placed these prohibitions to the first visit, requiring x-rays and exams, but not paying for them, right? Roll forward 50 years. The only way for us to get this changed is it has to pass through the House and the Senate on a bipartisan bill.
Huh?
Do I need to say more? No. So, if you want to see the exam that is required and should be done, covered. If you want to see reevaluations covered, if you want to see therapies and acupuncture and everything else covered, then reach out to your senator and say, get behind the Chiropractic Modernization Act, and then it will be covered. In the meantime, it is not. But you're not alone. We've been treating seniors for a very long time. So we do have payment plans that we have. We have, if it's necessary, we have a program called Chiro Health USA, which makes the visits, it's like a secondary insurance, it makes the visits less.
Is this something that
Any chiropractor, well, they may or may not be on Chiropractic Health USA, but every chiropractor across the board should be charging you for exams, therapy, x-rays, things like that. And if they're not, they could actually get in trouble with Medicare, because it is definitely a non-covered service, and we're not allowed to incentivize. So I have these juvenile diabetes cards I give out at a lot of events, where we will write it down to a $20 donation to juvenile diabetes, because I live in the autoimmune world too, but that's another day's story. So we can't even offer you those cards because we're not allowed to incentivize. So, but don't let that stop you from asking a chiropractor, myself or anybody else, about what can they do, how can they help, what will it cost? Because we are all quite adept at dealing with the fact that Medicare has not covered everything we do for the last 50 plus years.
So you are much more than just a chiropractor. So your business is, to me, sounds more like what I see is like a wellness center. Is it?
Yes, we're trying to be a holistic wellness center.
Okay.
3 of us do acupuncture. I've been doing acupuncture since 91, one of our doctors since 88, one of our doctors since 96. So we've got a lot of years of experience there. We have 6 chiropractors in the office. One has her master's in rehabilitation. So oftentimes if people can't afford to see us and go to physical therapy, we will do in-house evaluations for home exercise, right? So she has her master's in rehabilitation. We have another doctor who has his certification in sports injuries. So we are a diverse group. We don't all practice the same way. If they have patients who aren't healing, they will punt them to Dr. Carrie Horn or myself, and we will start looking at why aren't they absorbing nutrients, what do we need to do to break the cycle to enable better healing and better reduction of inflammation. So we try to be one stop as much as we can without drugs and surgery being on the table in our office.
Carly, is there a silver lining with aging and getting a diagnosis?
Yes, you are aging. That is a silver lining.
Yay! How about as far as things that the Arthritis Foundation services, information that they offer to help?
Yes, so the Arthritis Foundation, for those of you who are not as familiar with it, it's a nonprofit that funds, research at some, hospitals and universities, as well as provides resources like exercise programs or webinars, podcasts, community type events. So they fund research as well as they help people that are dealing with one of the hundreds of forms of arthritis that exist. So you can go to local events here. We just had our annual Walk to Cure Arthritis, which was in April, and it's just a 1 mile, very slow, go at your own pace walk that we had at Logan University. But again, it just gives you the opportunity to meet people that are kind of going through similar things and bring some joy, smile. There's tons of kids. A lot of kids get arthritis as well. I know, I was 15 when I was diagnosed, but people get it at, in their first 12 months of life and live with it their entire lives. So there's a lot of reasons to go out and get involved, but there's a lot of good information. So if you're not as computer savvy, maybe, there's some brochures and such in the back. But finding maybe a local community would be beneficial if you're not as computer savvy.
So information I have is that arthritis, including osteoarthritis and rheumatoid arthritis, is the leading cause of pain in seniors and affects more than 54 million adults in the United States.
Yes.
Okay.
Yeah, this month is May is Arthritis Awareness Month. So actually, if you're on Facebook or if you do any social media, there's a lot of information out with latest statistics and things like that.
And I think this stat, 25 to 50% of seniors experience pain, I think that's like way off. I don't know.
I think it's probably 100.
Yeah. In closing, Dr. Crosby, any advice in regards to chiropractic care and relating it to seniors?
If your pain is preventing you from moving, see a chiropractor. They will evaluate you. They will identify the best way to kind of treat for that area of pain. If they feel it's something that they cannot help you with, they will refer you to others. Like, if you need a shot in your knee, or if you need a partial knee replacement or a full knee replacement, or whatever it is. But start in the most conservative way possible. And I think that chiropractors, because we don't do drugs and surgery, we really are going to try to figure out how to heal you, how to have you heal you in a more effective manner, right? So maybe for that knee or hip pain, we have to put orthotics in your shoes just to resolve how you're walking. But that's a really great place to start, because starting with drugs and surgery, you can't undo it, right? And even pain shots, sometimes we co-treat with pain management, because if we're kind of on a plateau, if we can get a shot and get some pain reduction, and then we can kind of get a little more aggressive about changing the mechanics, then that helps that shot do its work better, especially if they're not walking around on a short leg, right, or a rotated pelvis. So then those shots become way more effective.
Well, that's great to hear. That I didn't realize that pain management works in with that. So, all right, well, this has been great information. I've learned a lot. So let's carry the knowledge forward that we gained here today and keep having proactive steps towards a life filled with vitality and well-being. So can we get a round of applause for our guests? Now we're going to do questions. So Miss Evelyn had her hand up first.
Yes, Mike, I know that you said that we could lift one leg at home while standing, and that would be perhaps a good movement exercise. Can you show us at least one more that we could do at home,
Sure.
please?
Yeah, I learned this from Washington University physical therapy director. One of the things that we have a problem with is our core. When you get tired from walking, most of us think it's our legs. It's usually our core, right? So we can strengthen and stabilize the core, the hips. You can bend your knees about 5 degrees, squeeze your quads, well, you don't use your hands, but squeeze your glutes, grip the glute, and then step, squeezing all these muscles, right? And there's a principle with strengthening muscles. Just make them tired. Just wear them out. It's not that hard, right? Wear them out. So that's a great one to do at home.
Okay, thank you. Yes, ma'am.
Okay, we're exercising, fruits and vegetables every day. What about like a fruit and veggie supplement like Juice Plus?
I like Juice Plus. In fact, I put my parents on it when they both had cancer. My dad was still on it. My mother actually stopped taking it, and then her cancer rebounded within 3 months of stopping taking it. She just got pill fatigue, and so I think it's good. If I have patients who absolutely won't eat fruits and vegetables, I will suggest it, and I see that unfortunately in a lot of kids. That we can't get them to eat fruits and vegetables. So, but I also think that parents don't bring them in the house enough for them to eat them. So I think it's good, but I think you don't get the fiber, and we didn't even discuss the microbiome today, but you need that fiber because you can take a probiotic over the counter, and that is the aerobic or the oxygen requiring bacteria, lactobacillus, bifidus, those kinds. But 70% of the good bacteria in your gut will die in oxygen. So the only way to get it is to consume the foods that grow it, and you need fiber for that. So fruits and vegetables, hands down, for however many millennia we've been around, have been the way to do this, and still are.
Thank you.
Yes.
Yes, ma'am.
I just like to, champion the issue on falls. I've been a caregiver for many years, and I see clients that one fall starts a downward spiral in their lives. That's when the kids come in and they start saying, Mom, Dad, we gotta
Do something here.
So that, balancing is huge.
I want to respond to that because I want to, number one, highlight it. Thank you so much for that. That's so powerful. One of the things that that we need to know about balance and strength as a 1-2 punch, right? Being able to, having balance and having strength to move your body is the concept of mobility. When my wife and I started OsteoStrong, we talked to a lot of seniors in our area about what's most important to you. And I grew up in the finance world. So I'm thinking financial legacy, 401k, how are my kids gonna make it without me? Those are the things that I'm thinking seniors are concerned about. Guess what I learned? It's mobility. It's mobility, and I saw it as my dad died. It took him 16 years to pass away, and every year he lost more mobility, and he lost more of himself.
Independence.
That strong, powerful, independent man that he was, right? And this is powerful. Please hear me on this. If you're not paying attention, please hear me. I see it every day in my world. People do not enter into assisted living or skilled care because they're sick. It's because they can't get out of their chair. Keep getting up. And when you can't, keep trying. And get up and keep moving. I can help, she can help, she can help.
So just real quick, I wanted to share, one time I was showing clients, it was 2 women that were doctors, and they were relocating to our area. And I'm showing them this new house, and I'm bragging. I'm like, wow, these got the comfort height toilets already for you. And they were, no, we would rip those out. And I'm like, why would you rip those out? And she said, because having the low toilets forces us to get down to a lower position, builds up our core strength. So that was just, I was like, oh, that makes sense, but naturally we're all living on the higher toilet. So, and that was just one of the things that they mentioned is helpful to them.
I'm just gonna leave the whole thing.
How many of you feel like you want to keep going and rocking and rolling and making it happen?
Yeah.
How many of you? Raise your hand. How many of you feel like you got at least one tool in your toolkit today that you can use today, tomorrow, this week? And how many of you are going to use that tool? Fantastic. Fantastic.
Well, thank you. That's like perfect ending. So, anybody, we have time for like one more question or comment? Okay.
I want to make a comment. For those of you who are using YouTube, you can even find things like chair yoga,
Yes.
right?
She found it already.
I have it.
There you go. All right. So you can be moving, even if your balance is questionable. You could be starting to work on strength from a chair while you figure out your next steps.
The Arthritis Foundation has those videos as well. Chair and
That's
Tai
right.
Chi and, yoga and all these things that are modified for people that have pain.
All right, check that out, guys. That sounds like a great resource there. So, okay, so in conclusion, just wanted to pass on, next month, we are having some 2 panelists to come in and talk about mental health in seniors and also related to the grieving process and just mental health in general that we as we age experience, or the lack thereof with mental health. And then we also have, and I'm saying this because it kind of tied in with some things that came up today, we also have a geriatric pharmacist coming in. And I met her, and she has a book, and she talks about the interaction of different medicines and evaluating that and how to help avoid all of that, different medications and trying to get off of medications as well. So anyway, thank you so much. How about another round of applause for our audience? We're going to stick around for just a few minutes, so if you have any questions, and if you guys wouldn't mind turning in your goldenrod sheets at the back on your way out. There are handouts and some freebie stuff that they all brought, so please help yourself to information and that. Yes.
Thanks, Sarah.